And we are back with another one of our candidates for the Maine House of Representatives. This is Donna Bendiksen. Donna is a resident of James Street, and she's running for the seat in House District 115. She represents, if she's elected, the Back Cove area of Portland. Donna is a full-time housewife. Donna, this is your first time running for office. Tell us a little bit about your background and how you decided to take the plunge.
Well, I'm a native Mainer. I attended university for a couple years at USM, and I'm married to Adam. I have 2 grown children. I've worked in healthcare for 25 years as a excuse me, a direct care provider. And I really wasn't interested in politics until a couple of years ago when my oldest son joined the Army. And because we were at war, I was, excuse me, I got really concerned about what was going on over in Iraq, and because I knew eventually he'd be there. And from researching news, and I guess I became a political activist. And in that research, I became very concerned about the economy. And this past winter, I was approached and asked if I would run for public office, and because I have the time and because I'm deeply concerned about what's going on and I don't see any solutions coming out of Augusta, I thought, why not? So that is why I'm running.
Now, you were not only a healthcare worker, but I think you had to work your way through some health insurance issues on your own, did you not? Didn't you have an injury of some kind?
I did. I had an injury at my last job, working as a healthcare provider, and that's still ongoing, actually. It hasn't been resolved, but it will be soon. And
do those experiences you have on sort of both sides of the healthcare issue lead you to have certain ideas about certain programs you would like to see enacted by the legislature in Augusta in the healthcare area?
I would like to see a lot less regulations in healthcare. Right now, I don't feel like we have freedom of choice, and that includes both with healthcare services and with payment options. As a healthcare worker, what I noticed is that doctors spend a lot of time doing paperwork. They spend a lot more time doing paperwork than they do with patients, and ditto for registered nurses. They spend a lot more time doing paperwork and pushing medicines rather than actual patient time. I also had my own wellness company from 1999 to 2005. I sold nutritional products. My biggest clientele came from people who wanted to lose weight. But I put everybody on a nutritional program, and I saw the benefits of what good nutrition could do for people. And my experience with my own personal doctors and with talking to my peers when I was at work is that a lot of these people don't really know much about nutrition.
Could that be a key to lowering costs in the state if everybody became more aware of a wellness program like that and practice better health in their eating and exercise?
Absolutely. I know myself, I've been taking nutritional products now for almost 10 years. I've avoided surgery. I've gotten off from prescription medications. I've helped a lot of people lose weight. I've helped diabetics get over diabetes. But I'm not allowed to say that I did that, because if I say that, it's like I'm saying I'm practicing medicine. And I didn't do that. What happened is that these people got nutrition, their bodies started working like they were supposed to. And that's basically it. But over and above that, you know, when a person goes to see the doctor, there's really only 2 choices. They either get cut open or they get a prescription. And neither one of them really work that well. I mean, I'm not dissing the medical system, because if you are injured and you need that kind of care, yes, they can help you and save your life. But I believe there are a lot of solutions that aren't being talked about. So health freedom is an issue, and also the way we pay for that is an issue, because right now we have what I like to think of as a monopoly going on in our healthcare system. When you're not given a choice on where you can get your health services from or how you can pay for it, the companies that supply that don't really have to worry about competition, so they can raise their prices up. They can give you lower quality service, and that's what we have in Maine. We have a monopoly.
So you're one of those people who would subscribe to the notion that if we could make our health care insurance as easy to purchase as our car insurance, we could go across the border to any other state and shop around and find the best benefits at the lowest cost.
Why not? I mean, we go to Walmart to save money on goods that we buy. Why shouldn't we be allowed to shop anywhere we want for healthcare service or for insurance? But I didn't really mean to talk so much about that. What I really want to talk about is the economy and how that is affecting everything else, because the cost of fuel, I mean, you hear about the rising cost of gasoline, the cost of oil. What they don't talk about is the fact that one of the reasons why it costs so much is because our dollar is being devalued. Every time the Federal Reserve, which is a private bank, prints out more money, it increases inflation. It causes the value of the dollar to go down, which means that it costs more dollars to buy anything, not just oil. It's going to cost more money to buy food. It's going to cost more money to buy everything. And with this crisis that's going on a national level right now, the things that we are paying for right now with state government, the cost of that is all going to increase. So they're going to expect to have to collect more taxes from us in order to pay for those same services. And what I want to see is government streamlined down to the bare necessities, have more control at the local level, let local communities decide what's best for that community, and decrease the size and scope and the cost of state government.
And as a legislator in Augusta, what would be your first priority to attack that problem? Would you introduce new legislation?
I would introduce new legislation. One of the things that I'm concerned about right now is people losing their homes. One of the things that I would like to introduce is legislation that would extend the redemption period on foreclosures, maybe to 180 days, to give people more time to come up with the money to pay for their mortgage, or maybe to give them extra money to buy heating fuel or something like that. Because putting people on the streets or having businesses shut down because they can't afford to pay their mortgage or they can't meet their needs isn't going to help us.
Well, we're just about out of time, Donna, so I want to have you take a minute to tell the voters watching the show why they should vote for you instead of your opponent.
Well, if you're really tired of paying more taxes or having more of your money go to wasteful spending, from what I've been able to observe so far between my two opponents is they are exactly the same. They want socialized medicine or socialized healthcare or universal payer, and both of those are going to cost money, and the only way that's going to happen is if we dole out more money for it. And again, it's going to create a monopoly, and as we know, without competition, a monopoly is not going to give us the services we need. I mean, Canadians come here because they might have to wait 2 or 3 months to get chemo treatment if they have cancer. I mean, I don't want that.
And that's the system we'd be looking at if we make the changes your opponents are asking for. Is a system very much like the Canadian system. Well, Donna, thanks very much for being with us, and appreciate having you here, and good luck in your campaign.
Thank you, Tom.